Central Ohio Primary Care is very excited to be involved in population health. Population health to us as an organization means that we will accept both financial and clinical responsibility for patients that depend on us for their care. Central Ohio Primary Care became involved in population health in 2011 when we began our process of becoming patient-centered medical homes. Patient-centered medical home is a team-based care approach to patients' clinical care. This team-based care involves front office staff, medical assistants, back office staff, and it puts the patient at the center of their care, period. All members of the clinical team can be involved in improving a patient's clinical condition. In patient-centered care, we as a corporation chose certain common clinical conditions that our physicians decided they would focus on for a given period of time. Those conditions for adults were diabetes, hypertension, and hyperlipidemia. For pediatrics, our physicians focused on ADHD care, obesity, and asthma. In order to improve each clinical condition in patient-centered medical home, we had to set standards or goals, and we would document in a patient's chart whether a patient was to goal or not to goal. If a patient was not to goal for a clinical condition, a physician needed to document what they would change in that patient's care process to get them to goal. We would also engage the patient in what they could do to improve their care. That gets back to the patient-centered medical home being patient-centered and a patient-centered approach to care. Through the patient-centered medical home approach, we were able to improve access and decrease ER utilization. The decrease in ER utilization is tremendously impactful for patient care and to create value. Our same-day centers are available 7 days a week to provide improved access for all of our offices and all of our patients. Providing value, that is improved quality at a lower cost, is very important to us. We have been able to do that through initially beginning the patient-centered medical home process and now being fully engaged in population health. Our population health initiative began in 2014 with a specific population of patients. We decided to focus specifically on our Medicare Advantage patients. To improve our care for our Medicare Advantage patients, we began several initiatives in 2014. Those initiatives included care coordination for our highest risk patients. Those patients, the top 5 to 10% at-risk patients that we felt we could impact with improved care coordination. Our care coordination team is a nurse and a social worker that will work directly with the patient either in their home or in their physician's office to help meet medical needs as well as social needs that may be impacting their quality of care and their quality of life. Our transition of care nursing program is very important to our population health initiative. This transition of care nurse is a COPC employee that will engage a patient day one in the hospital, follow them through their hospitalization, and facilitate their discharge to home. At times, patients may not be able to go home initially and will need to go to a skilled nursing facility, and we can also facilitate that transfer. This transition of care nurse will reach out to the patient within 48 hours, reconcile medications, check to be sure that they are clinically stable, be assured that the patient has an outpatient visit. That outpatient visit with a primary care physician post-hospitalization is one of the #1 factors that can decrease readmissions. Central Ohio Primary Care has a very large hospitalist division. We have hospitalists at 4 local hospitals. If you are a Central Ohio primary care patient and you're hospitalized, you will be seen by one of our hospitalists at Riverside Methodist, Dublin Methodist, St. Anne's, and Mount Carmel East. These hospitalists have access to your outpatient primary care physician and your entire outpatient primary care record. Having access to that record allows that physician to know your history, know your recent medical events, and know your medications. While hospitalized, the hospitalist physician is in contact with your primary care physician. That contact can be by telephone or electronic. When discharged, your primary care physician knows your discharge medications, and has access to your inpatient record through our medical record. This continuum of care, offered by having hospitalist physicians as part of our organization, benefits you tremendously while hospitalized. Preventive health care is a crucial part of population health. COPC employs quality nurses. These are registered nurses that are checking your chart prior to a visit so that they can inform your primary care physician if you have care gaps. Care gaps are items such as a mammography, colonoscopy, or immunizations. Your primary care physician will receive an electronic notice prior to your visit clarifying your need for closure of care gaps.